A very good morning to one and all present here. As the saying goes, the best preparation for tomorrow is doing your best today. We are celebrating Silver Jubilee year of BSc Nursing program commenced in 1997. On account of the Silver Jubilee celebration, we, the alumni of Lakshmi Memorial College of Nursing, have organized this international webinar on career opportunity for nursing in Canada. I, Ankita, representative for Communication, Magazine and Bulletin of Alumni Association and Assistant Lecturer Nursing Foundation Department, LMCN, will compare today's webinar. Prayer is talking to God, but it's so much more than that. It's the beat of our heart, the attitude of our mind, the song on our tongue, the director of our thought. Now, let's begin this program with prayer to be led by Miss Christy, first year PCBSC student.
ये जिंदगी तेरी महिमा गाती रहे अब सदा। ये जिंदगी तेरी महिमा गाती रहे अब सदा। जब तक जियो तेरी महिमा करता रहूं ए खुदा। जब तक जियो तेरी महिमा करता रहूं ए खुदा। जिंदगी तेरी महिमा करता रहूं ए खुदा। जब से छुआ तूने मुझे नई सांस जैसे फिर से आ गई। जब से ही थामा हाथ मेरा बंद राह जैसे फिर से खुल गई। जब तक जियो तेरी महिमा करता रहूं ए खुदा। जब तक जियो तेरी महिमा करता रहूं ए खुदा। जिंदगी तेरी महिमा करता रहूं ए खुदा।
Thank you, Christy. Good company, good wine, good welcome can make good people. It's a great pleasure to welcome our resource person, Mrs. Jyoti Martis, Director of Care, Burton Manor Long Term Care, Prima Care Living Solution, Toronto, Ontario, Canada. Welcome you, ma'am. I also welcome Dr. Larissa Martha Sams, Principal, Lakshmi Memorial College of Nursing. Welcome you, ma'am. I welcome all our Lakshmi faculty, the delegates of this session. Once again, a warm welcome to you all. If your action inspires others to dream more, learn more, do more, and become more, you are a leader. Now, I request Dr. Larissa Martha Sams, Principal, Lakshmi Memorial College of Nursing, to address the gathering.
Good morning to one and all who have gathered here. Greetings from Lakshmi Memorial College of Nursing, especially the Alumni Association. It's indeed a great pleasure. The association is organizing this international webinar in commemorating the Silver Jubilee year of Lakshmi Memorial College of Nursing. We have great many alumni who have passed out from this institution who are placed in various parts of the world, who many we know and some we do not know. So it's a great opportunity that we have a great resource person who is one of the alumni of our institution, the Masters Jyoti Martis, who was really obliged to be the resource person today and to share her knowledge with regard to the career opportunities. The career opportunities for our passed out alumni are plenty. As we see currently, the opportunities are not limited to the specific countries. The countries which we have not heard some time back are also opening the doors for all the nurses, especially the nurses who have passed from reputed institutions, and the students, especially who are very interested to fly out of the country and to the new path of career of nursing. They are not only working as at the bedside clinical nurse, also in the different capacity as a nursing professional. It's really a proud privilege and honor for the institution that our students are doing well after their completion of their course. And many have also taken time to pursue their education in various specialities of their interest and as per the need of the scene wherever they are. So one such person is our resource person today, who is not restricted to her studies, what she has done in our institution. She has done something more than that. And today she is the director of care working in a prestigious institution in Ontario, Canada. I think we have some of the delegates who are come from Canada, that is the province of Newfoundland, who are also very much wanting our alumni to come and work in their country also. So this is really a great opportunities for all the participants. I wish all the best. May you use this opportunity to develop your understanding of the other opportunities that are prevailing in Canada. Once again, thank you and wish you all the best.
Now I request Ms. Kavana Rao, Treasurer of Alumni Association and Assistant Lecturer, Nursing Foundation Department, LMCN, to introduce the speaker.
Today we have amongst us an eminent personality, Mrs. Jyoti Martis, registered nurse. She had pursued her BSc Nursing from St. John's College of Nursing in India in the year 1994 to 2000. MSc Nursing in Lakshmi Memorial College of Nursing, Mangalore in the year 2006 to 2008. Diploma in Hospital Management, AIMS, India in the year 2001. To add to her credit, she had completed Nurse Educator Certification Program, York University, Toronto, in the year 2015, and also Fundamentals of Palliative Care Certification in the year 2019. Currently, she is active member of RNAO. She has 21 years of registered nurse experience in clinical nursing, nursing education, nursing administration, and management in hospitals, College of Nursing, with 8 years of long-term care experience in Canada. She worked as registered nurse in St. John's Medical College Hospital, Bangalore in the year 1999 to 2001. Principal, Dhanvantri School of Nursing, Udupi, India in the year 2008 to 2012. She worked as an assistant professor and HOD of Child Health Nursing Department, Athena College of Nursing, Mangalore in the year 2002 to 2012, and also been an education coordinator at Tender Care Living Center, Ontario from July 2014 to March 2015. She also worked as Assistant Director of Care Infection Control Coordinator, Tender Care Living Center, Ontario from April 2015 to April 2018. Currently, she is working as Director of Care, Berta Manor, Brampton, Ontario since May 2018. Madam has various accomplishments as a preceptor for RN students from Ryerson University, Toronto. Extendicare improved performance and quality, silver winner in the year 2017. Prima Care Living Solutions aiming high award in the year 2019. We are very delighted to have you, madam. Over to you, madam.
Thank you so much for the introduction. And I'm blessed to say that I'm a proud alumni of Lakshmi Memorial College of Nursing. And as you all know, my name is Jyoti Martis, and currently I'm working as a Director of Care at Burton Manor Long-Term Care Facility, which is in Brampton, Toronto, Ontario. Before I could begin my presentation, I would like to thank the Alumni Association for giving me this opportunity to be a part of the celebration. And I would like to congratulate the management, faculty, students, and alumni on this Silver Jubilee celebration. So I would like to share the presentation. Just let me know whether you can see the presentation. Are you able to see the presentation? So I hope you are able to see my slides. So before I could go into the career opportunities for nurses in Canada, I would like to explore about the provinces in Canada because it's very important. Before you could think of migrating your country, you need to know about the provinces, especially to Canada, because it's very different from our home country, as well as we have to get prepared for the climates in this province. So just a little bit about provinces and territories of Canada. Canada is the second largest country in the world, and Canada has 10 provinces and 3 territories. You can see the provinces are British Columbia, Alberta, Saskatchewan, Manitoba, Ontario, Quebec, New Brunswick, Prince Edward Island, Nova Scotia, Newfoundland, and we also have 3 territories, which is Yukon Territory, Northwest Territory, and Nunavut territories. So it's important to know these provinces and territories. The main reason is you need to know for which province you are planning to migrate. You also need to know what language they speak and what are the climatic changes. First province, which I'm just going to say a little bit about, is British Columbia. British Columbia is the westernmost province in Canada and has the 3rd highest population. And the capital of British Columbia is Victoria, and the largest city is Vancouver. The official language in British Columbia is English. An average summer temperature in British Columbia is 23 degrees Celsius, and average winter temperature is 3 degrees Celsius. Next province is Alberta. Alberta is the province in Western Canada. Calgary is the largest city in Alberta, and which is south of capital Edmonton. So capital of Alberta is Edmonton. The language spoken is English. Average summer temperature is 25 degrees Celsius, and average winter temperature is -6 degrees Celsius. Adjacent to Alberta, we have Saskatchewan. Saskatchewan is one of the prairie province in Western Canada. The capital of Saskatchewan is Regina. and the largest city in Saskatchewan is Saskatoon, and official language is English. Average summer temperature in Saskatchewan is 26 degrees Celsius, and average winter temperature is minus 10 degrees Celsius. Next one is Manitoba. Manitoba, you can see that it is also one of the prairie province of Canada, which is lying midway between the Atlantic and the Pacific Ocean. Winnipeg is Manitoba's largest city. The official language in Manitoba is English. Average summer temperature is 20 degrees Celsius and average winter temperature is 16 degrees Celsius. Coming to Ontario. This is the province where I live. When Ontario is in east central Canada and is the most populous province. According to it's accounting for nearly 40% of country's population, and it is the second largest province in total area. Toronto is the capital of Ontario, and Toronto is the largest city. Official language is English. The average temperature is 25 degrees Celsius during the summer days, and during winter days, it's minus 2 degrees Celsius. The main attractions in Ontario, you can see CN Tower as well as Niagara Falls. Quebec, it is the French-speaking province. To practice in Quebec, you need to know you need to have French language proficiency. The temperature varies between minus 27 degrees Celsius in the month of January to 24 degrees Celsius in the month of July. New Brunswick, you can see it is Canada's 8th most populated province. It's bordered to the north by Quebec, and to the east by Atlantic Ocean. Capital of New Brunswick is Fredericton. They speak both English and French, that's official language. Average summer temperature is 25 degrees Celsius and average winter temperature is minus 15 degrees Celsius. Newfoundland and Labrador. So Newfoundland and Labrador is the most easterly province of Canada, which is situated in the country's Atlantic region. It comprises of islands of Newfoundland as the mainland, Labrador to the northwest. Capital is St. John's. Official language is English. Average summer temperature is 21 degrees Celsius and average winter temperature is minus 4 degrees Celsius. Nova Scotia, it is Canada's smallest province in the area, and the capital is Halifax. Official language is English. Average temperature in Nova Scotia is 23 degrees Celsius and average winter temperature is minus 8 degrees Celsius. Prince Edward Island. Prince Edward Island is the smallest province of Canada in both land area and in population, which consists of islands of the same name as well as several much smaller islands. Capital of Prince Edward Island is Charlottetown. Official language is English. Average summer temperature is 23 degrees Celsius and average winter temperature is minus 3 degrees Celsius. Next, moving on to the territories. We have 3 territories. One is Yukon, which is sparsely populated. Average summer temperature is 14 to 20 degrees Celsius and winter temperature is minus 13 to minus 40 degrees Celsius. Nunavut is a massive sparsely populated territory of northern Canada. Average summer temperature is 10 degrees Celsius and a winter average temperature is minus 35 degrees Celsius. And the official language is Inuit, English, and as well as French. The next province, the territory is Northwest Territories. Uh, the average temperature is 20 degrees to minus 25 degrees Celsius, and official language spoken is English, and they also speak 11 other languages. Coming to nursing in Canada. So nursing in Canada, it is noble, well-paid career. There are over 300,000 registered nurses in Canada, but the officials predicts that in the next 10 years, there will be 191,000 job opportunities for nurses will be emerging. The COVID-19 pandemic has showed Canada and the rest of the world how important nurses are. As the country is recovering from the impact of pandemic, the need for nurses in Canada has risen. While nursing schools receives many applications, it may not be enough to fill the nursing shortage. To battle this crisis, Canadian government encourages nurses from all over the world to go live and work in Canada. So there might be questions coming into your mind. How should I migrate to Canada? There are different ways you can migrate to Canada. You can immigrate to Canada as as a process of express entry, federal skilled workers program, Canadian experience class program, provincial nominee program, as well as student visa. I'm not going to go in detail about immigration process because it will take a whole day to discuss about the immigration. But I'm mainly going to talk about the difference between permanent residence visa as well as student visa. What are the advantages of coming to Canada as permanent residents? So to apply to Canada for permanent residence visa, you should be having qualification. You have to apply under certain qualification category, and the applications are processed based on the point system. So your education, your qualification, your experience counts, and if you're married, then it's your spousal education, qualification also counts. The advantage of coming to Canada on PR visa is you will be, as soon as you land in Canada, you are eligible to work anywhere in Canada without any restrictions. You can get health benefits, as well as if you have children, the education is free of cost until the grade 12. So those are the main advantages to come to Canada as a permanent resident. If you're coming to Canada as a student on student visa, you have to apply for certain courses. My suggestion is, if you're applying for certain courses, please keep in mind that you select a course which is relevant to nursing, where you get some practical experience in Canadian facilities, which is important because once you complete your education and you're applying for nursing, then you would require to have this evidence of practice, as well as it will also waive off your language proficiency. So national occupation classification. So as I mentioned, when you're applying under the occupational category, there are certain categories you would like to, you should be applying. And if you're applying as a registered nurse, your skill level is A and your NOC code is 3012. So you need to keep in mind which category you are going to apply. So what should I know to become a nurse in Canada? So first of all, you need to know that without the licensing examination or without a license, you cannot practice as a nurse in Canada. As well as you also need to know that, so your credentials will need to be assessed prior to coming to Canada. And second thing, you need to keep in mind that you should be aware that a licensing process differ from one province to another province. That's why you need to make sure, or you need to have a clear idea of which province you're going to migrate, and based on that you need to start your process. So first step into nursing is getting your nursing credentials. So the first step to living and working in Canada as a nurse is to get all your qualification assessed and converted into North American standard by National Nursing Assessment Services, which is also called as NNAS. So application process for NNAS: if you're an internationally educated nurse and you wish to work as a nurse in Canada, except for Quebec and other territories, you must complete an application with the national NNAS. So you can apply on different categories. You can apply as a registered nurse. You can apply as a licensed practical nurse or registered practical nurse, or you can apply as a registered psychiatric nurse. So what does NNAS does? NNAS partners Canada's nursing regulatory bodies and offers a simple and secure way to review and store the documents you are required to submit in order for you to work in Canada. So the roles of NNSA is to review and store your documents, to verify that your documents are authentic, to ensure each nurse's files have all required documents, to determine if your documents meet Canadian standards, as well as to send the completed files to the regulatory bodies. So which means NNAS works as a mediator between you and the regulatory bodies. It collects all your documents. It gives you the credentials, and it compares with the Canadian standards, and it submits to the regulatory bodies. So what is NNAS process? There are certain steps you need to follow when you apply for NNAS. First step is to creating your online account. So once you create your online account, the second step is you have to submit your proof of identity. That must be notarized, and that should be submitted to NNAS. Third step, you have to submit your nursing education form. So that needs to come directly from your college, from where you have completed your education. Fourth step, submit your nursing registration form. So you need to download and print this form from your online account, and then you have to ask your licensing authorities from where you have license or registered outside of Canada. For example, you have studied in Karnataka, so Karnataka Nursing Council is your licensing authorities. So the registration form has to be submitted to Karnataka Nursing Council, and once it is completed, they have to send directly to NNAS. Next step is to submit your nursing practice employment form. So this form also has to be downloaded, and the forms needs to be sent to your employers. For example, after your studies, if you have worked as a clinical instructor, if you have worked as a staff nurse, so wherever you have worked, you have to send these form to your employers, and they need to fill this form, and that form needs to be submitted to NNAS. Step number 6 is language proficiency. If your first language is not English or French, you will need to complete the language testing and have the results sent directly to NNAS from your approved language testing agency. So language testing can be IELTS, So if you're taking your IELTS, the lowest acceptance scores are speaking 7, listening 7.5, reading 6.5, writing 7, overall 7 in academic format. You can also write CELBAN, which is Canadian English Language Benchmark Assessment for Nurses. The score speaking, you have to have 8, listening 10, reading 8, writing 7, which also has to be in academic format. If you're uh, if you have to produce the French language proficiency, then you have to take TEF. The acceptable scores are speaking 5, listening 5, reading 4, writing 4, vocabulary 4, and that also has to be in academic format. If your first language is either English or French, you may not have you need not take English language testing, but you must meet the following criteria. The criteria are: the main language where you live and work is English or French, and your nursing education program of instruction must be in English or French. Second thing, you can show the evidence that you have safely practiced nursing within the last 2 years, where the main language used was English or French. So once you meet those criteria, then you have to submit the application fees, which is about $650 US. So you have started with your NNAC process. The next step is you need to know the regulatory bodies. So as I previously mentioned, when you think of immigrating to Canada, you need to know the provinces. So based on that, you apply to NNAC and let NNAC know which province you are applying for. And NNAC will send all your documents. Once it is approved, that will be sent to the regulatory bodies. So there are various regulatory bodies in each provinces. Since I'm from Ontario, I will be discussing about College of Nurses of Ontario, which is a regulatory body in Ontario. So CNO has 8 registration requirements. First of all, you have to apply to CNO online. And requirements are, so these requirements, there are some of the requirements are already met because you have already applied to NNAS. So these requirements are nursing education. You must demonstrate the successful completion of a nursing education program designed to prepare you for the type of nursing that you want to practice in Ontario. Example, if you would like to practice as a RN, you should have the education, which is BSc nursing. If you would like to practice as a registered practical nurse, then you have to have the diploma, which is GNM. Evidence of practice. You must show that you have recent experience practicing as a nurse. Most applications to the college automatically meet this requirement by completing the nursing program approved by the college within the past 3 years. So if you're a student and if you're a fresh graduate, so you have to send your transcript from your college that needs to be sent to the College of Nurses of Ontario. And in your transcript, you have all the hours which you have completed during your clinicals, and that will be counted or that will be evaluated by NNAC to give the equivalence approval to write your NCLEX RN examination. The next step is registration examination. So you must successfully complete the registration examination approved by the college for the type of nursing you want to practice. If you want to practice as a registered nurse, you have to write NCLEX RN examination. And if you want to practice as a registered practical nurse, then you have to write REXPN examination. So REXPN examination, this is the new exam Previously, it was CPRNA examination. Now they have in Ontario and British Columbia, they have started the online examination similar to NCLEX RN, and this is for the registered practical nurses. Next step is jurisprudence examination. Jurisprudence examination, this is mandatory for all the RN and RPNs to practice. This examination includes several questions which are mainly based on the laws and regulations related to nursing. Next step is proficiency in English or French. As I mentioned, so you have to submit this language proficiency to NNAC, and NNAC will submit this language proficiency to the regulatory bodies. Sixth step is authorization to work. So you must provide a proof of your either citizenship, resident status, or authorization to practice nursing in Ontario before you could register as a nurse in Ontario. So it is important that though if you're coming as a student, once you complete your studies, then you have to get your work permit to work as a registered nurse. Past offense and findings. You must truthfully state whether you have been found guilty of an offense, refused registration, had a finding related to the practice of nursing or another profession against you, or an involved in certain proceedings. This is similar to police clearance, where you need to be cleared to work or practice as a nurse. And the last one is health and conduct. You must declare whether you suffer from any physical or mental condition or disorder that could affect your ability to practice nursing in a safe manner. So once you meet all these 8 requirements, then CNO will give you the eligibility to write NCLEX RN examination. So NCLEX RN examination, so this also a step-by-step process. So first you start with NNAC. NNAC will evaluate your credential. That NNAC will send all your documents to CNO. CNO will look into your documents, and CNO will give your eligibility to write NCLEX RN examination. So please do not write NCLEX RN examination without getting the CNO eligibility, because if CNO is not giving the eligibility to write NCLEX RN examination, then there is no point in you writing the NCLEX RN examination, because if it is written without the CNO eligibility, then CNO will not accept it. So after the college notifies you that you are eligible to write your NCLEX RN examination, next step is you have to go to Pearson VUE NCLEX RN registration page. And when you're ready to write your examination, pay the required registration fees to the Pearson VUE. That is a site where you have to register for NCLEX RN examination. Wait to receive your authorization to test from Pearson VUE. Once you have received your authorization to test, go to the Pearson VUE NCLEX RN site and schedule a day to write your examination. So please make sure you follow these steps, because I have seen a couple of candidates who write their NCLEX RN examination without the approval, and then they regret for not submitting their documents to CNO. So as I mentioned, there are different regulatory bodies. You can see here, British Columbia has British Columbia College of Nurses, Nursing Professionals. Ontario has College of Nurses of Ontario. Saskatchewan has Saskatchewan Registered Nurses Association. Manitoba has College of Registered Nurses of Manitoba, as well as Practical Nurses College of Licensed Practical Nurses of Manitoba. Alberta has College of License for Alberta. Yukon has College of License Practical Nurses for British Columbia. Similarly, all other provinces and territories have their own regulatory bodies. So, types of nursing in Canada. So, you need to know, as I mentioned, to practice as a RN, you have to have your bachelor's in nursing or bachelor's of science in nursing. This is the 4-year course which we have it in India. Similar course we have it in Canada as well. It's a 4 years university course, and once you complete that university course, then you will get the eligibility to write your NCLEX RN, provided your credentials are met. Registered practical nurses. So registered practical nurses, this is a 2 years diploma course, or if you are a general, if you have completed your general nursing, then you can apply for registered practical nurses. And sometime the Indian the qualification, the Canadian regulatory bodies will not approve the qualification of some of the colleges to practice as a registered nurse. So in that cases, you can also apply for registered practical nurse until you get your approval for registered nurse. Third category is registered psychiatric nurse. So in Saskatchewan, Manitoba, Alberta, and British Columbia, the term RPN is used for registered psychiatric nurses, where they provide care for the patients who have mental illnesses. So RPN in Ontario, it's for registered practical nurses, and other provinces, it's for registered psychiatric nurses. Nurse practitioner. So once you complete your bachelor's in nursing, if you want to go for your further studies, you can do your master's in nursing and then then you can pursue your nurse practitioner program, where you can independently practice as a nurse in the acute care settings or as a family practice. What is the difference between RPN and LPN? So there is actually no difference between RPN and LPNs. This is just the name. In Ontario, we call them as RPNs, and all other provinces, the registered practical nurses are called as licensed practical nurses. So CNO has made some changes for easy processing of internationally educated nurses. So the nurses who have migrated to Canada on the basis of permanent residence or student visa, and if their evidence of practice has been expired, or if they're not able to provide language proficiency, so they can apply for this program, which is called as SPEP program, that which is Supervised Practice Experience Partnership Program, where the CNO will send the applicant to the facilities, and the applicant has to complete their certain hours in the either in the long-term care facility or in the hospital, so which will consider as their evidence of practice, as well as their language proficiency will be waived out because they are working in an English speaking facility. So many of the internationally educated nurses have taken the advantage of this, and recently I did have 4 internationally educated nurses who recently got license from this program, and I'm happy to say that. So one of the candidate whom we who came to our facility was from Lakshmi Memorial College of Nursing. She was one of the BSc student from Lakshmi Memorial College, and she completed her evidence of practice, and now currently she is working as a RPN. Next classification is temporary class registration. This is also a the new program from the CNO for easy for the internationally educated nurses to work in Canada before they could complete their NCLEX RN examination. So for this they have to apply for general class registration, and when they're in the process of general class registration, and if it is taking time to complete their NCLEX RN examination. Meantime, they can apply for temporary class registration and they can work as a licensed nurse. But it has the limitation of only 2 years, and within 24 months, the candidates has to pass their NCLEX RN examination. So, what are the job opportunities in Canada? So, as I said, Canada has a lot of opportunities for nurses. You can work in hospitals, you can work in school, you can work in long-term care, you can work in extended care facilities, rehabilitation centers, doctors' offices, public clinic, private clinic, tertiary education institute clinics, community agencies, private companies, private homes. You can also be self-employed. So, what are the career opportunities at the hospital? You can work as a nurse manager, you can work as a nursing supervisor, you can work as a clinical resource nurse, charge nurse, clinical nurse, nurse educator, infection control coordinator, discharge planner. Career opportunities in long term care. So, you can work as a vice president of the company, you can work as a clinical consultant, executive director, director of care, associate director of care, behavior support nurse, RI-MDS coordinator, nurse educator, infection control coordinator, nurse in charge, quality nurse, floor nurse. Opportunities in the community. You can work as health and community care manager. You can work as health and community care coordinator, community nurse, school health nurse, home care nurse, public health nurse, and immunization nurse. Specialties. There are a lot of specialties. You can work as a cardiovascular, you can go into cardiovascular nursing, gerontology nursing, rehabilitation nursing, neurosciences, psychiatric and mental health, oncology, peri-anesthesia nursing, hospice palliative care nursing, enterostomal therapy, community health nursing, critical care nursing, perioperative nursing, perinatal nursing, orthopedic nursing, medical surgical, emergency, critical care, pediatric, gerontology, occupational health, nephrology, and many more. What is the average salary for nurses in Canada? So, this varies from province to province. So, before going into the salary range, I just also want to explain y'all how the nurses are getting paid. So, there are two categories. So, one is unionized, another one is non unionized. Unionized, which means you are under a union. For RNs in Ontario, it's called as Ontario Nurses Association, which is ONA. And for RPNs, you do have different unions like QP, Leona, different unions. So the nurses are getting paid on hourly basis. So hourly rate varies. It can be from 27.20 per hour, or it can go up to maximum of 56 to 57 dollars per Canadian dollars per hour. So this is the basic rate, and usually the nurses work, the regular hours is 7.8 hours, and in that half an hour break, so regular hours you work is 7.5 hours, and you the salary is bi-weekly. So in bi-weekly, if you are a full-timer, you will get 75 hours bi-weekly. And if you wish to work extra hours, then you will be, if you're in a day, if you're working more than 7.5 hours, the additional hours you worked is a overtime, which will be 1.5 hours. Similarly, bi-weekly, if you're working more than 75 hours, additional hours you worked goes into overtime. So that's how the salary, the hourly rates are for the registered nurses and registered practical nurses. So you can see the hourly rate changes. And for those who are in non-managed, non unionized. For example, like in a management positions, so they are salaried, and the salary is it's a package. You get an annual package of you get the package from starting from anywhere between 80,000 to 130,000. So that is the average rate for the salary staff. So this is just for your information. So in case if you have questions about how much I will be getting when I work as a nurse, so this is the average rate for each provinces, and you can see that it varies from one province to another province. And also the salary increases based on your experience. You can start with annual salary of $55,000 Canadian dollars. It in 2 to 5 years it can go up to 67,000. 5 to 10 years it can go up to 95,000. 10 to 15 years 111,000. 15 to 20 years 123,000. 20 years plus 130,000. So this is the average salary change by experience. Any questions? Anyone has any questions? Anything you would like to ask?
Any queries from the delegates? Thank you, ma'am. That's so informative. I am sure our participant learned a lot from you. Ma'am has highlighted on provinces in Canada, opportunities regarding nursing services in Canada, and the immigration process in Canada, RN examination requirements in Canada, types of nursing in Canada. Thank you, ma'am, for sharing your experience with us.
Thank you so much for having me.
The feedback link is shared in the chat box. Kindly fill it to receive your e-certificate. Develop an attitude of gratitude and give thanks for everything that happens to you, knowing that every step forward is a step towards achieving something bigger and better than your current situation. Let me first of all start by giving glory to the Almighty God for making today's session a resounding success. First and foremost, I thank our resource person, Mrs. Jyoti Martis, who despite her busy schedule has found time to be with us. Thank you, ma'am.
Thank
We
you.
are grateful to Dr. Larissa Martha Sams, principal, for her continued support. Thank you, ma'am. I owe special gratitude to the Lakshmi faculty and delegates. Thank you all. Last but not the least, I thank members of Alumni Association for their tireless efforts in organizing today's webinar. Thank you one and all. It's never-ending battle of making your care better and also trying to be better yourself. I, Miss Ankita, signing off. Thank you. Have a good day. Oh.